Myopia or nearsightedness is the world's most common vision problem. By 2030, doctors predict nearly half of North America is expected to have myopia. Today, we are joined with Dr. Kimberly Orr with Triad Eye Associates. We are talking about myopia concerns and, of course, the treatments. Now, you can also ask your vision-related questions. All you have to do is text them to 336-379-5775, and we will answer them live throughout our 30-minute conversation. So, Dr. Orr, thank you so much for joining us today.
Yeah, thank you for having me.
All right, so we'll start here with this question. What is myopia?
So, myopia is nearsightedness, and it basically just means that the eyeball is too long. So, instead of light focusing right on the back of the retina where it should, it focuses just in front and creates a blurry image when people look far away.
Why is it important for people to know what it is?
It's important for people to know what it is so that they can get that checked out as soon as possible, because the earlier that we can intervene and treat, the less likely there are to have complications later on down the road.
Why is myopia a concern?
So, myopia is a concern because if it gets to be too strong of a prescription, then it can increase the risk of certain conditions such as glaucoma, early onset of cataracts, retinal detachments, and even just as simple as when it's early on, it can create a blurry image so kids can struggle in school if they can't see the board very well.
Let's move into the causes. What causes it?
So a lot of times there is genetics involved, but also lifestyle factors can impact it. So you can have increased screen time or less time outdoors. Parents are always asking me to remind their kids to get off of the tablets and the cell phones and the screens, because that can significantly increase the risk factor. But there are definitely some genetics involved as well.
And since you kind of talked about just the concerns and things of that nature, can too much screen time injure your eyes? Like, what's a good amount of time that you should be, your eyes should be set on the screens?
Yeah, so the answer is always really hard to implement, because they do say that if we can limit that to 2 hours a day, that's the best. But the world that we live in is constantly on screens. The way the schools are now, it's almost impossible to meet that criteria. So just doing the best that we can to not have all of our free time be on screen time, but instead have our free time be outdoor play and recess and going on a walk with our family and anything where we can focus far away.
I've seen people purchase those like blue light glasses or something like that that help you when you're, trying to maybe or I think it's the blue light glasses. You're the professional, but something like that to help when you're looking at the screens. What do you think about those?
Yeah, so the jury's still out as to whether or not it really helps with digital eye strain, but I do have a lot of patients who use a blue light filter in their glasses and feel like it helps on the screens, whether it's the placebo effect or science that's yet to be proven. They do know that it can impact sleep cycles. So trying to limit screen time at night. A lot of the phones will have a night mode or things like that, and that's where that stems from, is the interrupting our sleep cycles and keeping us awake more at night when we're on screens for a long period of time.
Okay. What's the best way to treat myopia?
So to treat the blurry vision, we use glasses and contact lenses to do that. But on the other side of treating it, we used to just think that if the kids' eyes were getting worse and worse, that was just how their eyes were, and we'd just go with a stronger prescription. But now we can actually do things to try and slow down that progression. So there are special soft contact lenses that are out there, one called MySight that is designed to slow it down. There's a hard contact lens option called orthokeratology that can slow down the progression, and then as well as a eye drop that is dosed at night. It's low dose atropine. So if you have a child who has nearsightedness and you're interested in trying to slow down that progression, definitely have a conversation with your eye care provider about some options.
How often should you get your eyes checked?
Once a year is what we tell patients. Oftentimes, if I have a child with myopia, especially if they're progressing quickly, I may see them sooner, like every 6 months instead.
Okay, well, we are going to pause right here, but of course, we're going to continue the conversation after the break. Remember, Dr. Orr is answering all of your vision-related questions. All you have to do is text them to the number right there at the bottom of your screen. We'll be right back.